Is cesarean section medically justified? This was the perspective challenge put up by Praveen Badalkar, and I feel obliged to tell about my perspective towards this. Too many women are really having cesarean sections in India, and I feel that it's everybody's fault. You'll ask me how, and let me say, until 2010, the survey which was conducted by various public health departments about the C sections and also the research which has been done, it shows that the cesarean sections were limited to around 8.5% till 2010, and slowly, gradually, it is increasing. Well, the recommended level is 10 to 15% of all the births, which was set by the guidelines of WHO. So, even a few number of cesarean sections without any valid reasons, that would be a critical thing for the people who conduct it, according to the guidelines of WHO. But in the last decade, according to the reports, various reports like WHO reports, or the report which was conducted by ICMR, the School of Public Health, according to all that, you see that the numbers have escalated very fast in many parts of the country. Almost they have reached around 41% of all the deliveries. In Kerala, you would see it is 41%, and in Tamil Nadu, it is about 58%. And every part of the country, you'll see it's going on increasing. There are various reasons for this increasing number of cesarean sections. Mumbai, it saw a exponential growth in the number of C-sections, both in the private sector as well as in the public sector hospitals. One study which was conducted in January 2007 to December 2012, it showed a spike of around 31% to 51% around a span of 6 years. That was in rural Haryana. Meenakshi Gautam, she was the India's country coordinator for the maternal and the newborn health programs at the London School of Hygiene and Tropical Medicine. She said that the private hospitals, they tend to be very scalpel friendly or scalpel happy when it comes to this C-section procedures. Of course, it's easier to do the C-section. It doesn't have a waiting time for the doctor, as well as it is very hassle free. So, in India, the cost of C section varies widely. The variation, it depends on many factors. It can be the geographical area, it can be the accreditation of the hospitals, or the facilities which are given by the hospitals according to the different accreditations, and whether it is a public hospital or a private hospital. All these factors matter for the cost price of the C sections. Now, there are some doctors who are fighting the trend. Not all hospitals charge high for the C sections, or it's not a matter of money for many of the hospitals. Amidst all these financial settings, some doctors are really hoping to fight so that financial trend or the money matters. So they bring down the number of cesarean sections and they care for the patients really. And there are these doctors who charge the patient a flat, almost equal fee for both the cesarean section as well as the normal vaginal delivery. So, when you find all these things, there are some bad eggs in the profession. like any other profession. You'll find some people maybe extracting money. No doubt, you'll find that the patient term is just converted to the client according to the medico legal, new medico legal terminologies. And also the consumer courts, they refer the patient as a client. Now it is a business word. So we can understand the uh, advantage or disadvantage to the concerned people. Now, coming to the patient wishes, it's not always the doctor's fault, too. Too many of the doctors are working for the patients very nobly. And patient's wishes, when you come to the patient wishes, you'll see that the decision is not just in the doctor's hand. Sometimes the patients too come with a fear, with an anxiety, and they wish that the cesarean section be conducted. Some patients, it is the auspicious dates. They will say that I want my baby to be born on Ekadashi or some other auspicious festivities or some muhurat. They will come with some auspicious time and date, and they want the birth of the baby to be on that time. There are patients I have seen myself. Also, there are some ladies who are just afraid to bear that labor pain, and they just want to avoid the pain during the labor, and then they wish for the cesarean section. Patients who come with their own sets of beliefs and biases, and they wish that cesarean section be conducted, and even though if the doctor is not willing, they still go to another hospital. So this is the trend which is going on nowadays. When you say it's hardly, it can't, we can't say that it is hardly specific to India. You will see that in China too, there are people who are going through this trend. So it's an increasing trend. Almost 50% of mothers in China are delivering through C-section. So patient preference plays a very large part of the high number of the C-sections procedures happening. Now, during these conditions, counseling and education, it goes a long way to combat all the myths surrounding the c-sections. And if actually the women are educated about the total information regarding the c-sections, about the hazards or about the complications or the benefits if needed, all things should be given, information should be given to the patients, and then the women will be ready to understand the things and take her own healthy decision. This is about the patient's wishes. Now coming for the health risks, there are many health risks too. It's not that cesarean section only carries the health risks. Even the vaginal deliveries have their own risks. Complications are there in every birth. So it depends on the women's health. So basically, when you keep your own body healthy, even if it is a normal vaginal delivery or even if it is a cesarean section, you will be able to bear that, and the number of complications will be reduced. So health risks, about the health risks, you'll see that few of the patients, they don't even bother to explain or ask to the doctors about the things. And some doctors also don't bother to explain and counsel the patients. And a few of the doctors, they completely explain all the pros and cons about the delivery and about the cesarean section and everything. So counseling is an integral part. While I teach gynecology at the college, we teach about the antenatal care, antenatal counseling, then the after the delivery, the postnatal counseling, everything is there. And actually in the hospitals, how much of is this is done is a big question mark. There should be a inquisitiveness from the patient, and the patient should also demand the counseling. The higher number of cesarean sections, it can be attributed to the changes in the lifestyle and health. It plays a big role, lifestyle and maintaining one's own health. The average age of the patient at the suburban Mumbai, where the cesarean sections have been conducted, is around 32 years of age. And women above the 35 years of age are said to be at higher risk during their pregnancies. So ultimately, cesarean section has to be conducted. This was a study conducted by the Mayo Clinic. There is also a spike in the number of patients who are obese. So ultimately, the lifestyle, the metabolism, the nutrition, the diet they are having, all these things matter. Person who is obese is more prone towards developing diabetes and hypertension. These two are considered as the high risk pregnancies. We see that children at the younger age are becoming more obese. Ultimately, that will affect when they are coming to a reproductory age after marriage, during pregnancies. Obviously, they will carry the risk of the pregnancy, high risk pregnancies. So these people, they develop the gestational diabetes, that is diabetes developing during the pregnancy. And these are the two main factors which will produce the complications during pregnancy and at delivery: diabetes and obesity. Diabetes is said to be the mother of all diseases. The main culprit, you can say, is the combination of dietary and metabolic changes associated with the lifestyle. Less physical activity. Nowadays, right from the childhood, children don't go outdoors to play, have less physical activity and involved uh, in the digital technology. So they stick to their chairs. Right from the childhood, we are developing this kind of lifestyle. So that is why it has led to the skyrocketing rates of the diabetes and obesity in coming the recent years. So you will see that the Indians, these are much more vulnerable to the type 2 diabetes, which is mainly associated with the lifestyle. As the study which was conducted in 2011, it was found that around 336 million people globally are affected with diabetes, and around 61.3 million are living only in India. So that is a huge number. Ultimately, these people will develop all the complications during the pregnancy and deliveries. That will lead to increasing number of cesarean sections. You can see that 7.3% of the country's population is diabetic. This was a study in 2007. So ultimately, by now, the number has increased drastically. So you'll find that around 5% people are obese, 15% are overweight, and this was a survey which was done by the Obesity Foundation of India. And probably it is more in women. Now, coming to the counseling part, I counsel all the ladies who come with pregnancy for the antenatal care. I counsel them about the factors of lifestyle, about the diet, about the nutrition, yoga, exercises, meditation, and spirituality also. This is a program which I conduct that is called as the Garbha Sanskar. And through Garbha Sanskar's counseling, we guide them to the right way to adopt the right psychology and activities for a healthier mother and baby and for a easy delivery. Now, coming for some reasons, you'll find that everyone suddenly thinks that childbirth should always be perfect. Should it be? And can it be? That's not the nature. Your human body is very vulnerable. Just like death or any other nuances of the body and life, the understanding of the body mechanism is quite difficult, even though the science has become so progressive. It is very unpredictable at times. So, there is a need of change in the medical regulations in the healthcare institutions too. So, all around, you'll find that cesarean sections you can't justify. You can't justify the explanation, you can't give the explanation regarding whether the cesarean section is justifiable or not. Everybody is at fault, and we need to improve the lifestyles, we need to improve the diet, we need to improve the nutrition, and we need to develop our own psychology to improve our own health, because health is our birthright. This is Dr. Rajeshwari Rapita signing off until we meet again.